I would call it unregulated, unlegislated edicts coming out of the administration. And it comes through the regulatory agencies like the EPA and the Department of Education, the Health and Human Services. And the way this is apparently happening is through the deceit of this administration. When they pass legislation and you guys vote for it, it has 5 little words in it. And this is what's killing us with regulation in this country. Those 5 little words are, as the Secretary shall decide. The secretaries of these organizations, these regulatory agencies, are driving legislation and making their own laws because of those 5 little words. Is there anything you guys can do to put a clamp down on that?
Well, I think if you look at the past year, a lot of that legislation isn't happening anymore. You're talking about legislation that occurred before this past year, and the problem is it's law already. And it's law because you had a House that was Democrat, you had a Senate that was Democrat, and a President's Democrat. Everybody kind of forgets that. You know, the President sometimes, I think, forgets that. He's been in office 3 years, and 2 of those 3 years, he had full control to do whatever he wanted to do. But 3 years later, he's saying he needs more time. I mean, I think he's had his time. And I think that's the answer. The answer to what your concern is you really have to work really hard. If you don't believe in the direction our country's going, which I don't, if you don't believe in the policies the president has, which I disagree with, we need to change the president.
Sure do.
Let's get him and then we'll come up here.
You've mentioned something that I think we're all aware of, and that you've talked about the broken system, and I'm curious, you've talked about things that you have done in good conscience since you've been down there. I'm curious that since, 2010, when the young wave of Republican conservatives have come in, can you give us some examples of what you have seen introduced, and I realize it's just the House, what have you seen introduced to fix what's broken from that standpoint? Not necessarily legislation, but fixing the broken problem. And before you address it, I'd just like to say I had the opportunity of working a project in Central PA, and I was flying into BWI on a regular basis. And after all the things you hear about Nancy Pelosi and her plane flying out to California, it's nice to see our representative getting on a Southwest airline flight with the rest of the common guys.
The best thing I can tell you is that the budget that we passed last year, although not perfect, changed a lot of system issues. And the budget that we're going to try and pass this year will change a lot of the system issues. Now,
can you address some of those? I mean, specifically, like...
Well, when it came to the Medicare program, I mean, it basically said that anyone 55 and older, nothing would change, and that under 55, there would be, and I forget the words, the exact words, but, you know, there would be dollars. How that would work, if you were under 55, when you got to 65, you would lose Medicare. You know, that was the Democrats. Well, you lost Medicare, they're changing it forever. No, it was means testing. So if you were a millionaire and didn't need as much, you got less, and if you were poor and needed more, you got more. But there was ultimately an amount of money that was given to help pay the cost of a federal program that changed Medicare. So that was one of the systems. Now you have to go through that system. Now the Democrats said you were changing Medicare forever and you were going to throw grandma off the cliff, and you know, all those commercials pushing grandma over the hill. I mean, if you haven't seen those, you saw it, you're going to see them. But quite frankly, that wasn't the case. It's an opportunity to change the system, and that's how we have to do it. You know, system sometimes changes by people getting involved. This is I'll tell you a story the President of the United States told us, the Republicans. And I might have mentioned this earlier, but you talk about a system. When he was running for president, he had a rash or something on the back. Now this is him speaking, not me. And he says that he went into, he goes, I understand what you're talking about, guys. You know, he was standing in front of the Republicans. There was no TV cameras there at the time. He said, when I had a rash on my back and I was running for president, I went into the pharmacy, gave them my card, they gave me some cream, and I left. And I went back on the road. And a couple weeks later, the rash was still there. I went into the pharmacy, gave my card, He gave me some cream, and I kept going. He says, the third time I went into the pharmacy, I didn't have my card. They said, it'll be $400. He said, I don't need the cream. If you think about it, that's how you change the system. Because when you have the magic card that doesn't put you in control of what you're paying for, then you get charged anything. So you got to have your system. Nobody should come between you and your doctor, though. Nobody. See, that's what the president's plan today wants to do. When you talk about the iPad board, they will make decisions. Nobody should come between you and your doctor, but ultimately, you need to come between you and your provider as to how much it costs and how much you'll pay. And I always use this example. I went to the dentist last year. I had my card, and he said, we got to x-ray your teeth. Well, I don't like to have my teeth x-rayed, but he said, well, it's a year, you got to have your teeth x-rayed. So, okay, x-ray them, I guess preventative, that's fine. Then he said, but I got this, now that I've x-rayed your teeth by putting that thing in your mouth, I'm going to take you to this thing that goes over your head and spins around your head. And I go, I don't want that. Well, it's part of my x-ray, and I got to get it done. And if you think about it, I didn't want it done anyway, but he says, no, it's part of my x-ray program. If he would have told me that cost X, I would have told him no. But he said, no, the card covers it. It's part of the system. We have to fix this system. Because no one knows whether I needed that x-ray around my head or not, but at least if I knew what it costs, like we all do, when somebody says you have to change your roof or this or that, you go out and get bids and you test the system. That's what we got to do in the government. That's what we got to do in our healthcare system.
Okay, I think we're about out of time.
We'll take one more, and then
How about the president giving away 7 Alaskan islands? Isn't that unconstitutional?
Yeah,
How did he give them to Russia? I mean, people going to spend.
again, I don't have the specifics on that. A lot